Hi, Rosemary. It's nice to see you again.
Come in, I'm glad you made it.
Gee, Rosemary, it's nice that you asked me over to talk this afternoon.
Well, I'm glad you were able to make it and find us here. Hi, I'm Rosemary Bolza. I'm a certified nurse midwife. Our college, the American College of Nurse Midwives, has a history caucus, and we're doing interviews to get stories from midwives. And Kathy Puls, Kathy, has agreed to be interviewed today.
Yeah, thanks. I'm Kathy Puls, and I have been a nurse midwife for 45 years, and it's been a fantastic career, and now I'm retired, and I'm enjoying retirement.
So to start with the beginning, where were you born?
I was born in Estherville, Iowa. I grew up on a farm that sort of was straddling the Minnesota-Iowa border.
Were you born in a hospital?
Yes, I was. And my mother was a full-blown eclamptic when I was born. The doctor had told her to watch for convulsions, and to her a convulsion was a grand mal seizure. But she had been going around for a month prior to my birth going,
Oh my goodness.
but was never recognized as having a petit mal seizure. So I'm kind of lucky to be here.
You right away recognized the importance of the intrauterine.
Good nourishment, yes.
And where did you go to high school?
In Estherville, Iowa. Well, small school. And then from there I went on to Mankato State University for my bachelor's degree in nursing. And then during my senior year, was exploring options of getting a master's degree and had sent off inquiry information. And Joyce Cameron from the University of Utah called me one Saturday afternoon, and we talked for 3 hours. And if anybody knows Joyce, she just is heart and soul midwifery, and there was no turning back after I talked to Joyce.
So you went right to midwifery from that finishing nursing.
I was so green I squeaked. It was Joyce and Lorraine Sivkovic had the patience of a saint to take this very young nurse and make her a nurse midwife.
And you went to the program at the University of Utah?
Right, and we did a couple of stints down on the Navajo Indian Reservation at Shiprock, just to get more experience. And
had you ever been out west before?
family vacations to Colorado, but that was about the limit of it. And it sure is a vast country out here.
Yeah, I was, so many people have never even heard of Shiprock. And it's...
Yeah, you were just down the road a piece in Fort Defiance. Yeah.
And that project was started, that was one of the original nurse midwifery projects within the Indian Health Service. I have some of the historical data, and they said they convinced the administrator they needed more space because they had the well child clinic right across from his office, and all the kids cried so much.
The psychology of it.
So I always feel like midwives in the U.S. don't realize how much they owe to the women that we've served in the Indian Health Service and the tribal facilities. Because back in the early 70s, there were not so many practices where you could actually go and work as a midwife.
Yeah, they were pretty much in large city hospitals or the Indian Health Service or Frontier. It just really was very, very limited.
So when you graduated, where did you go to work?
Well, I was busy chasing my husband down here to the University of Arizona. So, and I caught him too. And so I was down here for 2 years, just as assistant director of nursing for OB-GYN when we opened the University Hospital.
Wow.
And then he finished and went to Chicago, which where I was for the next 43 years.
Yeah, I was just looking at the University Hospital this morning, walking the dogs. And I was like, this was the original part of it.
Mm-hmm. Yeah. It's changed a good deal from what it was in 1971, 72. Way back then.
And so then when you were in Chicago, what was your career like there?
Well, Kathy Camacho Carr recruited me for a midwifery service that was a joint effort between Illinois Masonic Medical Center and the Chicago Department of Health. And that was probably the most unique interview I've ever had. Kathy had me meet her at the hospital at a particular time, and she happened to have 3 patients in labor, and she says, well, we can talk over the patients. Here, go change into scrubs, and you can do labor support. So it was sort of an interview by fire. And Kathy and I became great friends, and I worked there for 8 years. And the program evolved just a bit and finally ended up just being an Illinois Masonic program. But we had students from the University of Illinois College of Nursing, and probably in our peak, we were delivering 50 babies a month, and there were 8 of us, 4 full-time and then 4 part-time. And the part-times were all University of Illinois faculty who wanted to keep their clinical skills and helped cover our call schedule.
So when you'd been part of the health department, were you doing home visits there or clinics?
No, we were in the neighborhood health centers doing clinics. And I did because, again, I'm the Iowa farm girl via Utah who just really knew nothing about inner city Chicago. And so I would go out more for my own learning and do home visits. Kathy Dunn, who later became a nurse midwife, was a public health nurse that took me out into the projects. And I just couldn't believe it. I mean, heat was from a gas stove, and the furniture was the back seat of a car and a mattress on the floor in the projects. And it was just a real eye-opener on what the population I was dealing with, how limited their resources were. You know, we covered a pretty wide area. There were three different clinic locations, and then there were the 4 or 5 of us. I guess we eventually 5 of us that did clinics there, and then did the deliveries at Illinois Masonic.
And then you went on to have a private practice, or what did you?
Well, I was with. Like I say, it evolved to be just Illinois Masonic nurse midwifery practice, and then I finally got pregnant and had my daughter, and then I retired because I'd been waiting for this child for 10 years and thought, that I should, really devote myself to motherhood. Yeah, well, positive Q. I just went nuts. Even though I love this child and was breastfeeding full time, I needed something else. When you've been on call and in a busy midwifery practice and are used to working 40 to 60 to 80 hours a week, to just drop out of that was quite a blow, kind of thing. So I stayed home with her, got involved more in national and local ACNM. That was the time when I was president of the Chicago chapter for 4 years, and there was peer review and legislation and is there another committee? Anyway, there was lots to do for the American College.
Yes, really. What year was that? Would have been the late 70s.
No, by that time we're into the middle to late 80s. Yeah, because
that was the insurance crisis too.
Right. Yes. Kind of thing.
So what was the insurance crisis?
Couldn't get liability insurance.
Right, there was no company that would provide malpractice insurance for midwives.
And many of the hospital departments required liability insurance in order to have hospital privileges. That was the clinker. You know. Okay.
So it was like a catch-22.
And it, I think midwifery really came close to being wiped out again during that time. So the work that you did then was so vital to the profession growing and now being maintaining and even adding more midwives and services.
Yeah. Because at that time there was our Illinois Masonic practice. There was a practice at the University of Chicago. Of course, Cook County had a huge practice, and then there were a couple of nurse midwives in private practices, very small practices, but no practice at the University of Illinois. And so we were really groping for student experiences, and so yeah, it was small back then. There were like 24, maybe 36 of us in Chicago. And now there are hundreds of nurse midwives in Chicago. They pop up all over the place.
And the birth centers and home birth practices too.
Yeah, Illinois Masonic was the first in-hospital birth center. And I was lucky enough to be part of that starting. I remember the first time one of the physicians just thought he'd poke his head in, and we just had a big queen-size bed that we caught babies in, and there's the patient on her hands and knees and the nurse midwife in bed with her and catching this baby, and my colleagues said they saw him going down the hall shaking his head and going, "Oh my goodness, oh my goodness." But it all worked out, very, very well. And Illinois has been slow to come onto the out-of-hospital birth center. I do believe they have them now, but we're talking 30 years later, kind of thing. And home birth, I'm not that familiar with home birth in the Chicago area.
Your daughter was born, and then you did a lot of professional work, and you have a son?
Yeah, 20 months later my son came along. And then he was probably about 6 months old when Trish Walcott called me. She says, "What are you doing?" And I said, "I'm ironing my sheets and pillowcases." And she goes, "Good God, woman, you've got to go back to work." And so I went to work with Trish and Kathy Dunn, and I think there were 2 others. They were in a practice up in Evanston, catching babies at Evanston Hospital. And still is a great practice. And so I joined them and was with them for like 5 years. And then from the group practice, branched out into a single private practice of my own. I bought Barbara Orcott's private practice at Evanston Hospital. And as near as we could tell when we did it, it was the first time a nurse midwife had bought the single practice of another nurse midwife. So it was interesting to look up the legal ramifications and how we did it that way. But how much do you pay when you buy a midwifery practice? We thought we did sort of use the medical model of when one physician buys another physician's practice. And then I was in that practice for 15 years with good medical backup. I had 3 female physicians that I worked with, and their attitude was sort of, "Call me if you need me," and they really, let me practice as I wanted to, and it was fun again, teaching them that hands and knees deliveries, side-lying deliveries, being in second stage longer than 2 hours, it was okay. Your outcomes were okay, you know. And not everybody needed 24-hour electronic fetal monitoring, that you really could monitor with a Doptone, especially when you're with the woman and not out at the nurse's station. And that was also about the time Evanston Hospital put in the tub room so we could labor in the tubs. And then I learned you always have to keep a set of underwear in your locker, because when you're doing labor support with somebody in the tub, you get saturated to the skin. You can change your scrubs, but then you've got 2 wet marks. You know? So so you learn things like that as you go along.
But that sounds great. Like it was, I'm sure the patients, the women really loved that.
I think so, because there were women that would come to the practice. They sort of fell into 2 categories. One that really didn't want any interventions, wanted midwifery support so they could do this without medical interventions. Or 2, they didn't care what interventions they had as long as they had a person that they knew and trusted as their care provider. So the one that gave them prenatal care was going to be the one in labor and catch the baby. There were times when I was up 48, 72 hours, and when you finally got the baby, then you had to go do office hours. Or I'd finally get the baby and I'd really want to go home to bed, but I had a meeting at church that I had to attend. So I think any nurse midwife or midwife learns to time her energies and then push herself on through, so that she can meet her obligations, both for the patients and then just for family and friends and church too.
Did you have a limit to the number of paid clients that you took?
My maximum really was 10 a month, and I usually average 6 to 8. So, I didn't, very often I didn't need to change office hours. I may need to have scooched them back an hour or so, but to really miss a whole block of office hours was unusual.
Was the office close to the hospital, or?
That was what did it. I was right across the street. I could make it on a dead run in about 7 minutes. Do you still keep in contact with any of your patients?
Yeah, on Facebook.
Yes, Facebook and email are the best things for getting pictures of those babies you have caught. Some of them are getting old. In fact, toward the end of my career in Evanston, I delivered a baby of a baby I had delivered. Then they say, that's how you know you're getting old. Because 45 years, it would come around.
So so you do keep track of some of your babies?
Yeah, the woman that holds the record for the most babies that I delivered, she had 5, and I delivered all 5 of them. She and I still exchange notes and Christmas cards with the kids growing up. It's just, they do intellectually, but to see it is just fun.
Yeah.
Yeah.
And what advice would you have for people thinking about a midwifery career? Or for the young midwives?
Yeah. It's a lot of work, but it's well worth it. But you need to commit yourself to it. It's not a Monday through Friday 8 to 5 job. Carry a pager 24/7. You plan your family vacations a year in advance and let your patients know so they don't get pregnant to be due while you're gone. And they get to know your family as you get to know their families. Kind of thing. I think one of the fun demonstration kind of thing is I've had several patients who were wives of physicians. And the physicians always started out very skeptical as to, what was the role and what kind of qualifications, what could a nurse midwife manage. And they usually calmed down once they had a talk with my backup physicians. But I can think of 3 of them that after the first birth, it was sort of the same response. Well, we're not going anywhere else. Why would I want a physician to catch the baby? Because they had been educated in the medical model where, you come and you go and you're always doing this. And they really could see the advantages of the support and the one-on-one relationship.
Okay, well, thank you for sharing all of this, and I can think of so many more things to ask.
Oh, maybe another time.
Yes.
Yes, kind of thing. Thank you so much for asking me. It's been fun.
Yeah.
Yeah.